This meeting is called to order. Good afternoon and welcome to the November session of the Thousand Oaks Council on Aging. Commissioner Grimm, will you lead us in the Pledge of Allegiance, please?
Happily. Hands over your heart. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
It's good to hear all those voices.
Yeah, Francine, will you call the roll, please?
Absolutely. Commissioner Borghi?
Here.
Commissioner Fotheringham?
Here.
Commissioner Grimm?
Present.
Commissioner Healy is absent. Commissioner Loomis? Commissioner Norkin? Commissioner Shentes?
Yeah.
Commissioner Searden?
Here.
And Commissioner Silverberg is absent. Thank you.
Before we move on to public comments, I would like to wish our fellow commissioner and dear friend Mel Silverberg a speedy recovery. He had a automobile accident yesterday and is in Los Robles right now. And just want him to know that our hearts and prayers are with him. I understand he's going to be fine. Will be with us shortly. Get well soon, Mel. We need you. All right, let's move on to public comments. Jana Koval. Where are you, Jana? Right here. There you are. All right.
Hello. Hi, I'm Jana Koval, and I am with the Thousand Oaks Library. And I'm here to tell you all about this year's One City, One Book program. Our 2010 event for Thousand Oaks Reads is our citywide book club. If you have not heard about it, I do have some pamphlets on the back table here for y'all to get. Our book this year is Sweeping Up Glass by first-time author Carolyn Wall. And she will be here next week, right here at the Civic Arts Plaza in the Capley Theater for a talk about writing and her book. And also sign copies of her books, so if you have a copy, bring it with you. I hope you've all read it. If you haven't, I hope you're reading it or will read it before next Saturday. There are copies right now available in the library. We have been out. Almost 400 copies have been checked out for the past month, but we do have a few back on the shelves now, so you can check it out to read it. Or Borders and Barnes & Noble both have copies for sale if you'd like to own your own copy so she can sign it. We'll have a few on sale that day. But yes, Saturday, November 13th. The author, Carolyn Wall, will be here at the Civic Arts Plaza. You do need tickets, even though it's a free event, so everybody can come until we run out of the 1,800 tickets. But we are expecting a nice crowd. We had a nice crowd. This is our 4th year, so we're really excited. It's been a wonderful program, and hope you all have participated in the past, and we hope you'll participate this year. Oh, you can get your free tickets at either one of the libraries. The reference desks, just go up and tell them how many you want, and just bring it with you on Saturday, November 13th, and we'll see y'all there for the author event. It's at 2 o'clock, and I have flyers on the back table here, too. Okay? Thanks so much.
Thank you, Jana. Our next speaker is Audrey Feluga. Audrey?
Hello, everybody. My name is Audrey Feluga, and I've come to ask all the seniors for a big favor, if possible. I live in the ranch. It's a low-income mobile home park where they want to raise space rent for over 500%. Some of the people don't even make that much money to what they want to raise the rent and will be homeless. So what I'm asking everybody, if you can, if on our behalf, if you could write letters to Russ Watson, the housing person here, or else to the city council saying how unreal you think of this rent increase, or for them to be putting senior citizens of making them homeless, because most of the money is tied in their house. And a lot of people are medi and will be stuck. And I thank you all very much.
Thank you, Audrey.
Thank you.
All right, now we will move on to our main speaker of the afternoon. We are going to be talking about Medicare and the many, many changes. I'd like to introduce at this time the Director of Senior Concerns, Carol Freeman. Carol.
Thank you. What a wonderful crowd. It's always nice to see this many people and know that we've hit a topic that you all want to hear about. Greetings to members of the Council on Aging. Nice to see you all again, to the large crowd here, and to the faithful folks who are watching at home on TOTV. And my personal greetings off to Mel. I'm sure he's watching. Senior Concerns is here today to provide critical information about Medicare. It's one of those topics that you've heard it once, you need to hear it every year anyway. We've been around for 35 years serving the community. It's seniors and those who care for seniors. Our programs include, in case you don't know, adult daycare, Meals on Wheels, care coordination, lots of community education, brain fitness, in case you'd like that one, healthy aging classes. Look us up on the web or grab one of the brochures over here on the table if you're here in the room. You can look on the web at seniorconcerns.org. I'm also going to do a little plug before I introduce my friend Betty, that we have a Nutcracker Tea. We are a nonprofit organization, and we rely on great community support. And on December 9th, there is a Nutcracker Tea. It's out at University Village. They're kind enough to host for us. There's also a flyer here on the table. It's a delightful traditional Christmas tea with a special performance from our local Pacific Ballet ballerinas from the Nutcracker. So you will enjoy just a small segment of that. One program that is really a critical resource for our community is our Advocate and Care Coordination Program. In addition to seeing Betty flying around town wherever she goes, you also find somebody on staff at the Florence Strands Apartments, at the Tafoya Apartments in Moore Park, at the Simi Valley Active Senior Center, and at our own Gobo Senior Center. So if you're in any of those places, there's an advocate or care coordinator there for you to approach anytime you want when you have a question. However, today it's my distinct pleasure to introduce a treasure of Senior Concerns, and actually a treasure of Ventura County, Betty Berry. Most folks know Betty. Most folks know Betty because she writes that column in the newspaper every week and has been for many years. She joined Senior Concerns 17 years ago and started writing the column shortly thereafter. I don't have the exact date. She is a straight-shooting, phenomenal cauldron of knowledge. There is nary a question on senior issues that Betty can't answer or find the answer to. And there is not a soul she won't take on as an advocate for a senior. Betty is found all over the places I've mentioned. This little ball of fire cares about seniors, takes care of them, and demands they take care of themselves. I give you one of our jewels, Betty Berry.
Thank you, Carol. I take care of the seniors because I are one. Each of you have received a piece of paper. The top sheet is going to cover the subjects I'm going to cover today in the order that I'm going to cover them, so that we don't get confused and go back and forth. And attached to it on the back is my report card. We do keep track of these seminars and if they were worthwhile to you or not. So I would appreciate it when you leave if you would pull that sheet apart and leave the second sheet with us. Okay, that's this sheet that's attached to that. Okay, also I have to ask a couple of questions because we do keep statistics. You know how important those are. I'm just going to go down the list of cities. I need to know where the people are coming from where that I'm talking to. So is there anybody here from Agoura Hills? Okay. How about Camarillo? Oh my goodness. Okay. How about Moore Park? I'm coming there next week. I doubt anybody's here from Ojai. Okay. Or Piru or Santa Paula. Okay. Ventura? Okay, I'm going to skip Thousand Oaks for a minute. Anybody here from Calabasas? How about Fillmore? Oak Park. I know I have two from Oak Park. Okay. Oxnard? Wow. Port Hueneme? Simi Valley? I'm going there tomorrow. Could you not get in? Okay, they're full. We have 100 there tomorrow. Whoops, in the wrong row. Westlake Village on the LA side. Okay, now other than those who are from Newbury Park and Thousand Oaks, did I miss anybody? Okay, I can add those up and subtract. I'm not going to count those heads. Now, is there anybody here under 62? Don't giggle. Between 62 and 75? All right, put your hands down. How about over 75? That's better.
Wait, you got to keep them right. She's got to count.
Okay. Question for the ladies only. Are you female head of house? That means, do you live alone, or can your spouse no longer be head of house? Okay. You wonder why I ask these. That's what the cities ask us when we apply for grants. How many, this includes the gentleman, live alone? It includes the ladies and gentlemen. Okay. And does anybody, because I can't tell, does anybody here consider themselves disabled? Okay. Enough of that. Okay, it's Medicare time. This is my favorite time of year. And every year I say, I ain't doing this next year. And maybe I won't. But I'm going to start out with Medicare Part A and B deductibles, and we don't have very good news there because they haven't given us the information yet. Every year about this time we hear what the deductibles will be. Hospital insurance in 2010, the deductible was $1,100 if you were on straight Medicare. They haven't told us what it will be, so I think you can at least guarantee yourselves it will still be at least $1,100. That information, I don't know when we're going to get it. HICAP couldn't give it to us because they didn't have it, but when we get it, it will be in the article in the paper. Part B deductible, which you pay for your doctor visits in 2010, this year, was $155. Again, we do not have a new figure, but I can guarantee you it will be at least $155. And if you have to go into a nursing home, the coinsurance when you're there on Medicare in 2010 was $137.50. Again, we don't have a new figure. This is the first year we haven't gotten them this early. Don't know what they're doing in Washington. But it will be at least $137.50. They've increased every year that I've been on Medicare, so you can guarantee yourself they're going to increase. Okay, we're going to talk next about Medicare Part B premiums. That's what you pay every month out of your Social Security check or so on. Up until a couple of years ago, this was very simple. Everybody paid the same premium. Those coming in, those already in, no matter how much money you made, you all paid the same. Well, it's going to be different. As you know, this is nothing new to you, there'll be no increase in Social Security benefits in 2011. That's the bad news. The good news, there is a provision in the Social Security Act that disallows an increase in the Medicare Part B premium if there's no cost of living adjustment. So, to be protected by this provision, you must be having Medicare Part B deducted from your Social Security check. So if your check is coming to you with Medicare Part B taken out, which I'm sure will be the amount of $96.40 as it was last year, then you're not going to get a raise in your premium. However, there are 3 groups that will face a premium increase if one is announced, and I'm sure it will be. Those who are new to Medicare in 2011 will have a higher premium. Higher income beneficiaries, those who make more money then $85,000 annually if you're single, $170,000 annually if you're married, you will pay higher premiums. We don't know what those premiums will be yet. Sounds like I'm not going to tell you anything new. And beneficiaries who have their premiums paid by the state, those who are getting low-income subsidies and assistance and so forth, the state pays those premiums. It's not taken out of their Social Security check. Those will go up. So the state is going to pay more. So for those who are protected by having the premium raised, deducted from their Social Security checks, you will still just have $96.40 taken out. As of this date, though, the amount of Part B premiums for those who don't have it taken out of their Social Security check, we have no idea what it will be. Okay? That, too, will be in the paper. Medicare Part C. How many people knew we had a Part C in Medicare? Everybody know that? Okay, I did a presentation one day, and I said, I'm going to cover the ABCDs, and they said, what's C? Okay, for those of you who have an HMO or a PPO, you are Medicare Part C. Okay? It is the Senior Advantage plans. And these plans can be health maintenance organizations known as HMOs. They can be preferred provider organizations known as PPOs, or they can be private fee-for-service plans known as PFFSs. We don't have any PFFSs that I know of. The Senior Advantage plans in Ventura County, the HMOs, we have one leaving. Aetna will no longer be available to us. So those of you who are on Aetna HMO will have to make a new selection. SCAN is with us, Kaiser's with us, and in the west part of the county, not in the east part, Secure Horizons. Now, I have some page numbers here, so how many got this book in the mail? Oh, I like to see all those hands. Keep your hand up if you've read it. You really should read it. It's got a lot of good information in it. I remember doing that question last year, and some man came to me mid-year and said, you know, there really is information in that book. There is, and they spend a lot of money to put it together. So if you're looking for HMOs, I'm going to also talk to you about the individual ones here, but if you're looking, or if you think you're going to move and you're on an HMO, will my HMO be in my new area? The back of the book, pages 130 through 130F are information on those HMOs. We have 2 PPOs in Thousand Oaks, or in the East County. Anthem Blue Cross last year had 3 PPOs that you could choose from. This year, 1 has gone on vacation, so we now have 2. And I'm going to talk about the changes to each of the remaining plans. For those of you that are in LA County, you probably have more HMOs and PPOs available to you. They vary by state, by county, and they are listed in the back of the book. I'm going to get you to read the book, whatever. Okay. For those of you who are on Kaiser HMO, do I have anybody on Kaiser? Okay. Kaiser's going to stay pretty much the same next year. There is no premium still. The biggest change I see is in 2010. If you had the pleasure of having a ride in an ambulance, it cost you a copay of $300. In 2011, they've reduced that to $200. So instead of getting bells and whistles, you will get bells or whistles. SCAN is the other HMO that we have. It has stayed pretty much the same, except it now has a monthly premium. It will cost $29 a month. The deductibles are about the same. And just so you know how lucky you are, because, oh golly, the West County has Secure Horizons and we don't, you really don't want it because their monthly premium is $65 a month. So we're lucky down here. Okay, for the PPOs for Freedom Blue, what they did away with was they had a plan that had a monthly premium of $31. That one has gone away. They now have two plans, one that includes Part D prescription drug coverage and one that doesn't. And somebody asked me, well, why would I want to buy a plan that didn't have Part D coverage? Well, if you have retirement benefits and it includes prescription drugs, you wouldn't need another plan. If you have veterans benefits, you can get your prescription drugs there. You don't need that plan. So you need to look at each of these plans to see what suits you best. Back to you. How many had Aetna? Anybody in here had Aetna? Okay, do you know what you're going to get instead? Have you made up your minds? You're LA County, you're okay. Okay, yes, I see a hand over there.
I don't know at this time, but I have a meeting with my insurance guy.
Okay. Okay, as long as you're looking at it, because you have to make your decision fairly quick. Okay. So much for the yellow page. The enrollment period is ends December 31st.
Okay.
So we're going down there, but you got 6 weeks. That goes pretty quick. Okay. New services to Medicare. No, I want the questions at the end, otherwise we get all fouled up. Medicare new services. Again, in this wonderful book, Medicare and You 2011, pages 30 through 46, will list the preventative care that you can get with no copays. This is something new this year. When Medicare started in 1965, it was not a preventative program. It was, oh, gee, you're sick, let's get you well. Well, they found out that if they keep us well in the first place, it doesn't cost us much money in the long run, so they are giving us more and more preventative care. There will be more preventative care at no cost. It will eliminate cost sharing for Medicare-covered preventative services that are recommended by the U.S. Preventative Services Task Force. Didn't know we had such an item. And will waive Medicare deductible for colorectal cancer screening tests. So those are things that doctors usually prescribe. Now you can get them for no cost. They will also provide Medicare beneficiaries access to comprehensive health risk assessment and a creation of a personal preventative plan. Boy, that's a mouthful, isn't it? In other words, they will work with you and come up with a plan to keep you healthy and things that you should do. This is going to be free service to you. On the book, check page 45 at the back when talking to your doctor to see which tests are recommended and which are not, and work it out that way. Something else new in 2011 will be you will get a free annual physical every year. No-cost annual physicals really started this year for new enrollees with a welcome to Medicare. This physical had to be taken within the first 6 months of becoming a Medicare enrollee. Starting in 2011, all enrollees are eligible for a yearly wellness exam at no expense to you. So you want to discuss that with your doctors too. For those enrollees who were new in 2010, your first wellness exam can't take place within 12 months of the welcome one that you got the year you joined. But from now on, every year, you can have a physical at no cost, no questions asked, and no excuse for not having one. Here comes the nut of the thing. Medicare Part D changes. There's a HICAP counselor in the audience, and she and I keep looking at each other. This program drives us nuts, okay? These plans, I'm back to the book again, are listed on pages 133 through 133D in the Medicare 211. Every year, availability changes. Number of insurers change, number of plans change, premiums change, and formularies change. Therefore, it's in your best interest to review your needs and the current plan you have to determine if you have the best coverage for the least amount of money. And now is the time to do that. You can do it between November 15th and December 31st. There are now, in 2010, there were 23 insurance companies offering 51 plans for you to choose from. Okay? Made it a little easier this year. Now we only have 17 insurance companies, and they only offer 30 plans. For people, listen, it's one of these your plans. You've probably heard from them already if it is. But Aetna plans, 3 plans, all going away. Coventry, 3 plans, all going away. Fox Insurance, 1 plan. They were in it for 1 year. I guess it was not really a good deal for them. They came in last year. They're leaving this year. Pennsylvania Life Insurance had 3 plans, and they are no longer available. Sierra Health and Life Insurance had 2 plans, and they're going away. And Unicare had 1 plan, and they're no longer available. Also, AARP United Health has eliminated 1 of their plans. So if your plan is going away, I have seen letters that people have brought in. You have been informed that you have to do something between now and the end of the year. In 2010, just a little history here. In 2010, First Health D had the least expensive plan, and it was $17.60 a month. And Humana had the most expensive plan. It was $105.50 a month. In 2011, Humana will have both the least expensive and the most expensive. The least expensive is $14.80 a month, and the most expensive is $114.50. To determine what your plan covers for you best, you need to do comparisons, and there were sheets over there for you to fill out if you want your comparisons done by us. You can't really tell by looking at the sheet of plans, and that's the pink sheet that you got. You can't tell by looking at that what is the best plan. The premiums vary. Some have deductibles, some don't. Then some have percentages of what you'll pay for your drug, while others have dollar amounts. But nobody bothers to tell you what the full amount of the drug is in that company. So you really need to do the comparisons. You can do them yourself if you're computer literate, and we hope you are. Or you can call Medicare, and they will help you discover which plan is best for you, although you might be on the phone for a fairly long length of time. Or you can fill out the white sheet. There's a white sheet on the back, a bunch of lines where it says fill in the name of your drug, the size of your drug, and the number of times you take it. You can fill out that form and send it to Ventura, to HICAP, and they will work it out for you, and then they will contact you and either counsel you by phone or make an appointment for you at a Stop and Shop workshop. Or, if you want, you can fill them out and get them to the Global Center, and I will package them and send them up to Ventura for you. Your choice. I mentioned a Stop and Shop. Stop and Shop workshops have been scheduled at most senior centers during the latter part of November and during December. At these workshops, you can have your comparisons reviewed if you've had them previously run, or we can run your comparisons there that day and review them for you. And at a Stop and Shop, they can help you actually enroll in that plan. The Stop and Shops that are scheduled here in the East County: Tuesday, November 30th from 1 to 4 at the Simi Valley Senior Center. Wednesday, December 1st, 1 to 4 at the Moore Park Senior Center. Friday, December 10th, 12:30 to 4:30 at Goebel Senior Center. Monday, December 13th, 1 to 4, Moore Park Senior Center. Tuesday, December 14th, 1 to 4, Simi Valley Senior Center. And Friday, December 17th, 12:30 to 4:30 at the Goebel Senior Center. Now, I know you don't write all those down, but whatever city you're in, if you call your senior center, they can tell you when the one-stop shop is scheduled. If during 210, if you have gone into or will go into that dreaded donut hole, you will receive a check for $250. Okay? This lady said, whoopee, I'm with her, but hey, it's better than a poke in the eye with a sharp stick. It is mailed out approximately 45 days after the end of the quarter in which you go into the donut hole. So in October, November, December, if you go into the donut hole, you will receive the $250 check around the end of January, beginning of February next year. Now, I referred to this sheet. Yours is a little lighter pink. I didn't have dark pink paper. This is how it looks down the side. You have the name of the company, and next to it you'll have the plan name. They have 2 or 3 plans, maybe only one. Forget the contract number. The month premium, that shows you how much the premium is going to be for each month, and then it shows you if they have an annual deductible or not. Some have none, some have 150. The maximum deductible they can have is $310. Then they have how much it will cost you for your preferred generic copays. That's pretty clear. But then they get over here with other generic and brand names, and they give you a range of things. This is why you cannot really tell how much that plan is going to cost. Sometimes the higher the premium, the lower the cost of the drugs. I mean, they just do it back and forth. They talk about the donut hole. Most of them have no coverage in the donut hole. Some do cover many generics, and a few do cover some brands. If you wanted to contact an insurance company and talk to them, there is a telephone number for each on the sheet. Okay. Are there any, I'll take questions here about Part D. I know I shouldn't do this, but I'm going to. Are there any questions about Part D? Do people know which way they're going? Do they know what to do? Are most of you computer literate so you can do this yourself? Barbara, I'm not seeing any hands. Okay. Well, we can help you with that. Oh.
There's a question. One question.
Yes?
Okay, I have a question. I have Humana for my drugs,
Uh-huh.
and I've been trying to call them a couple of times, and they say busy or hold, and then I've just been getting disconnected, so I have not been able to get a hold of them. What do I do?
Okay, my suggestion would be, oh, excuse me, that's right. The lady has a question about Humana, which is the company she has, and she's tried to reach them on telephone, and of course she doesn't get through. I would fill out the white form, and I would either send it to Ventura, or I would bring it to the senior center, and I'll take care of it to get it to Ventura, and we'll find out what Humana is going to do for you, or what other plan might be good for you.
Thank you very much.
Okay? Yes?
This may sound very naive, and it is, I'm sure, but if you don't take any medications, do you need to get Part D?
Okay. If I don't take any medications, do I have to buy Part D? Yes, you do. If you do not buy Part D when you are first entitled to, then for every month you do not buy it, you will be charged 1% increase on the premium when you finally do buy it. So for somebody who takes no drugs, you don't need to do a comparison. Look down there and find that one for $14.80, which is the cheapest plan. Sign up for it, and you're in, and you will never be penalized. Okay? That's a very good question, and many people do ask that one. Okay, healthcare reform changes. There isn't a lot going on in the Health Reform Act for Medicare, at least at this point, but there are a few things. Part D, the donut hole, for 2011. Starting in 2011, if you reach the donut hole, you will be responsible for only 50% of the cost of that drug. Pharmaceutical companies, manufacturers will provide a 50% discount on brand name prescriptions filled in the Medicare coverage gap, and will begin phasing in federal subsidies for generic prescriptions filled in the Medicare Part D coverage gap. So you should see a big improvement in 2011. This will continue in following years until 2020, God, that's a long time from now, when you will only be responsible for 25% of the cost of the drugs in the donut hole. In other words, we're doing away with the donut hole. Yes, sir.
If you're only paying 50% of the cost, does that mean you're going to be in the donut hole for probably twice as long?
No. Good question. Gentleman wants to know if I'm only paying half, are they going to just give me half toward the credit to get out? No, they will credit you with both halves.
You said generic,
No, these are brand.
Oh, this is
Brand.
brand.
Okay. Now, just a little word about generics. This lady asked if it was generics. No, that's brand drugs. But if you are buying drugs and you think you're going to go into the donut hole, you can tell from the report you get back, and you know what you're paying each month. If you have some really expensive brand drugs, but you have a bunch of little generic drugs, then don't buy your drugs on your plan. Go to Walmart or Target and Costco and get them for $4. Because even though you might only pay $4 or $5 on the plan, what they add in is the cost of the whole drug. So it's much better for you to go do that, and it may keep you out of the donut hole. Okay. Now, there's two ways to look at this. If you have a lot of drugs and you're going to go into the donut hole early in the year, then buy them all on your plan, because you're going to go in and get out, and you'll be in the catastrophic portion where you pay 5% for your drugs. But if you're going to go in later in the year and not get into catastrophic drugs, then you want to stay out of the donut hole as long as you can, so you could buy your generic someplace else. Okay? Senior Advantage plans, that Part C that we talked about. I don't know how many of you know how Senior Advantage plans are funded, but they're funded by a lump sum payment each month for each enrollee in that company. I don't know for sure what the amount is, and it changes from county to county, but let's just use the number 500, okay? If you enroll in Kaiser, every month, Kaiser's going to get $500 from the government to take care of you whether you go to the doctor or not. They did this because they thought it would be the least expensive way to cover seniors. Well, they found out that the original fee for service doesn't cost as much as the Advantage plans. So they are going to reduce that amount that they pay those Senior Advantage plans each month. In 2011, the amount is frozen, so it can't go up anymore. And then in subsequent years, it will be reduced until the cost of taking care of somebody in a Senior Advantage plan is equal to somebody being taken by original Medicare. Okay? Yes, ma'am.
Does that mean that would be the end of Senior Advantage?
No, the Senior Advantage plans will still be there.
Because I heard it was going to end with this Obama.
Nah. Never, never. Senior Advantage plans will still be there. People have asked, will they put a premium on to make up? Will their costs, share of cost or co-pays go up? That's possible, but they're not going away, no. Yes?
You said they were funded by the government. I had heard it was the state and worried
No,
about
this is a federal plan.
Oh, it is?
Yes, ma'am.
And not taken out of the state?
This is federal. Okay? So this amount will be reduced annually through 2014 when the cost for Senior Advantage plans equals the cost for the other. Okay, one of the big changes that's going to happen is we are now going into our annual enrollment period from November 15th to December 31st. That 6 weeks period is your annual enrollment period. This is when you can change whatever you want to something else. You can come from an HMO to Medicare. You can go from Medicare to an HMO. You can go from an HMO to an HMO, whatever you want. And then on December 31st, it's set. Well, those of us who work this job really don't like those dates, because we have Thanksgiving in there, we have Christmas in there, New Year's Eve we work pretty hard. It's a mess. And to schedule things, because families come and go during the holidays, and there's more than just Christmas and New Year's, there's Hanukkah, there's all kinds of things. We have hard times getting days that we can do this, or seniors will say, well, I'm away those 2 weeks, what should I do? Well, okay. So starting in 2011, next year, those enrollment periods are going to be changed. And the annual enrollment period will be from October 15th to December 7th. So as you're planning along in this new year, and I know we all make plans, keep in mind that that enrollment period is going to hit you about 6 weeks earlier than usual. But this kind of coincides with what businesses do also. I mean, their enrollment periods are different. This change will be really better for all. Not only will we not have to work during the holidays, but it will allow the changes to be completed so that when the first of the year comes, everything's in place. We will have people come in on December 30th, December 31st that want to change, and then they get sick on January 2nd and they wonder why the new paperwork hasn't been completed. Okay? So this will give us that period of time to have everything in place. Now, in the past, after this annual enrollment period closes, there was a 3-month period from January 1st to March 31st when those of you who were on Senior Advantage plans could change plans. You were on Kaiser, you decided you didn't like it, so you're going to go to SCAN, or you were on an HMO and you decided to go to a PPO, and the sales personnel for these companies, these organizations, were running around like crazy trying to convince everybody that they should change to their plan because their plan was better. Sometimes that was true, sometimes that wasn't true. A lot of fraud was taking place in that period. So that has been changed also, and this year, which will be next year, this year at the close of business on December 31st, there will be a very short period of time from January 1st through February 14th when a person on a Senior Advantage plan can decide to come back to original Medicare and buy a Part D plan, and that's it. You can't change from HMO to HMO anymore after December 31st. The only thing, if you were on an HMO or a PPO, you'd been on it in the month of January, something happened, and you said, I don't like the way they work, I want to go back on original Medicare, you have that little 6-week period to do that. So basically what you should think about is on December 31st, when that clock strikes 12, what you got is what you're going to keep for the whole year. You're kind of stuck there.
Turn on your mic.
If you have an existing plan like Kaiser, do you have to re-enroll every year, or?
Okay, the question is, well, you could hear his question. No, you do not. If you're on a plan that you like, you just keep sailing along. Same for your prescription drug. There are people who are very happy with the drug plan they have and don't really care if it went up $5 a month. If what you have you like, you just keep it.
We have to use the mic.
Okay, that's better. Oh, she's bringing you a mic.
If you're on the Kaiser Senior Advantage, what is the status of the Part D
Okay. If you are in a Senior Advantage plan, that would be Kaiser, SCAN, or the Aetna PPOs, except for the one PPO. They have their own Medicare Part D plan incorporated into it. You must use that plan. If you don't like that plan, you like Kaiser, but you don't like that plan, and you decide to buy another Medicare Part D plan, you just lost Kaiser. And you will be without medical coverage for the rest of that year. Yes?
If you are on a regular supplement, not an HMO or a Advantage plan, do you have longer to change your enrollment period? Or does that end also on December 31st?
Okay, if I understand your question, you're on Medicare fee-for-service and you have a supplemental policy. Is that correct?
Yes, a supplement. Actually, I have Anthem Blue Cross. And I called to see how much my premium was going to increase in 2011. And they told me they would not be able to answer that question till the 1st of March.
Okay. That's the way it works, gang. Okay, you can change your supplemental policy. Now, this is if you have original Medicare and you have one of these Medigap policies to supplement what Medicare doesn't pay. You can change that plan anytime you want. However, two things will happen. One, you will have to go through underwriting to make sure you're healthy enough for them to want to insure you. And secondly, if it's a new plan, the cost will be based on a new age. Once a year, you can change that supplemental policy without any problem, and that is during the month of your birthday.
However, my birthday falls in December.
Well, you're out of luck. No, if they come along in March and tell you that your premium has gone up $100 a month, there's nothing that says you can't change your supplemental, but you will probably have to go under underwriting. Now, that isn't a scary thing completely. I mean, there's a lot of things we can have wrong with us that don't affect underwriting. But if you were in the process of some treatment for some serious disease, they might not want to insure you. Do you agree with that? Yeah, okay. That answer your question?
Yes.
And, you know, March, maybe we ought to ask Kathy about that. Okay. Yes.
Betty, earlier in the presentation, you said that AARP had eliminated one of their Part D programs.
Right.
I talked to them the other evening because I had that Part D program, have it right now, and they indicated to me they had deleted it. Okay. They did say the reason they deleted it was the government made them delete it, which I didn't believe.
I don't either, but that's okay. That's my personal opinion.
They were very adamant about it, and so I didn't argue with them. But they did say one thing which some other people might want to know if they happen to be on the AARP Saver program.
The Saver plan, right.
You don't have to call them to change because all they did was change you over to preferred, and you fall in that same category you were talking about earlier, where if you're satisfied with that, you don't have to change anything. So.
But if I had the Saver plan,
right,
and it went away like it has,
right,
I would certainly do a comparison to see what else is available to me, and wouldn't just take their word for it that we've put you in the other plan.
Yes, I understand that, but again, if you take so long that you're at the end of it,
true.
Yeah, they will in fact just go ahead and do it.
That's true.
All
you won't be without.
Right.
But you might not be happy either.
They might not be happy with it, but you won't be without it.
Another reason for doing comparisons this year is I understand that a lot of the formularies have changed.
Yes.
And so some of the lower premiums will probably not cover as many drugs as they've covered in the past.
Yes, that's a true statement. I asked them that question, and they said definitely.
Yeah.
So there's a lot of research research to be done right there, because
That's
you
right.
have to go through each prescription drug that you're taking
Right.
in order to determine that and make that decision you're talking
Right.
about.
And I've also had a couple of people come to me because whatever their problem is, the doctor has said, maybe next year, about February or March, we might start you on this. I've told them to include that in the list of drugs for their comparison so that they would know what it would cost if it's given to them.
For sure.
Wait, she's going to give you a mic, I think.
And I have a lady back here waiting.
Oh, okay, hold on.
I turned 65 in August. When am I supposed to enroll? I know nothing about anything.
Okay. You're going to turn 65 in August. Well, happy birthday. You're now in the golden years. You should go down to Social Security to enroll in Medicare Part B up to 3 months before your birthday. No later than 2 months before your birthday so that all the paperwork gets done.
And then the question about the Part D. If you start out with the cheapest because you don't need anything and you actually start having to take medication, then can you change any of these things?
You can change them in the next enrollment period, but for the year that you're in, you're stuck.
Okay. But you're saying that stabilizes a fee.
Right. For every month that you're having a birthday in August, so you're entitled to Medicare Part D on August 1st. For every month after August 1st that you do not sign up for it, and then finally decide to sign up for it, you will be penalized 1% per month of an average amount.
Okay, I was saying if you changed it, if you started out with $14 and then decide you
Oh, no,
wanted
once you're in, you're in. So
Okay.
if you start with the cheapest plan, and then next year or the year after you now have to take some kind of drugs, and you change your plan, no problem. Once you're in, you're in. And my suggestion, let's talk about the supplemental Medigap policies to Medicare, regular Medicare. I think you should study those and really decide what you want and buy that plan as if it was the plan you're going to keep for the rest of your life. Medicare Part D prescription coverage, I would review it every solitary year and maybe change it every year depending upon the drugs you're taking and the formularies that are offered. You know, it's no fun getting old. Yes, ma'am.
I was just going to add that I had Coventry for
a number of
years or
years
more. And in my package, my big package I got this past week, it is now First Health.
Oh, they changed it to First Health, so they did away with Coventry and they went into First Health.
Went to First Health,
Okay.
and my premium went up a couple dollars. My deductible went up from $100 to $150.
Okay.
But all the drugs that I take
Are still
were
there.
still in the formulary.
Fine. And so, you know, for that little bit, sometimes it's worth staying with what you have.
Not going through
Just a quick question. You mentioned the Medigap plans. According to the book, they have all these letters A, B, C, H.
A, B, C, D, F,
Okay,
G.
where do you find that? It's not in this book.
There's reference to the Medigap policies, but if you really want to learn about those policies, give me a call and come see me.
Yes, I'm a little naive. If you decide to go with Kaiser, and you said their medications are included within their program?
Right.
So it would do no good to fill out this?
No. If you're with Kaiser, well, Barbara, if they're with an HMO and they want to know about the formulary, they can still fill that out and ask us to run it for Kaiser. Okay. 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 If you're on Kaiser and you want to know what's in that plan, what formularies they cover and so on, you can fill out that form and send it in, and you're asking for HMO comparisons. But in our area, you'd only be comparing it against SCAN because that's the only other HMO you have. But the thing I want to emphasize there, because people quite often say, well, I'll just buy a Part D to go with it. Then you lose your HMO. And if it's in the middle of the year, you cannot re-enroll in Medicare, and so you're without Medicare coverage for the rest of that year. That make sense? Okay. She's getting her exercise today. Yes.
My wife is losing her job on the 17th of December. I'm presently covered under her company plan, and I want to change. How do you go about doing that without problems?
Okay, this gentleman's wife, he's on his wife's plan at work, and that plan is going away. Have you got Medicare Part A?
A only.
A only. You keep B. You don't need B until that plan goes away. So you need to go and sign up for B and also D. Now, she's losing the job on the 17th. Is she going to be covered through the 31st?
Under COBRA, yeah.
To be perfectly safe, I would cover myself as of December 1st, and you'll have dual coverage there for a little while, and then if and then that will continue on into 2011. But Medicare, Social Security will help you with that. He has his own mic.
Betty, if I were planning to move next year, say move near one of my children in another state, can I research the plans in that location?
Yeah, they're all listed. This book that you got in the mail is Southern California. So everything here is in Southern California. I mean, everything from Southern California is in here. If you were going to move to Nevada or someplace, you could call Medicare and see what's there. Also, if you are on an HMO or a PPO and it's not in that area, you have 63 days after you move to make a change. Yes.
I am presently on a PPO left over from my company.
Okay.
And the premiums this year will be $8,000. So we're having to go to HMO, and they're offering Kaiser and United Healthcare.
Okay, United Healthcare's HMO is Secure Horizons, and we don't have it here in this part of the county. Are you in LA? No. You're in Ventura. You can't have Secure Horizons. I know, but they can't offer you a plan that the county doesn't have. What doctors is she going to have? I mean, this has to do with, through her retirement or husband's retirement, she is on a plan with them, and one of the plans has gone sky high, $8,000 a year. Holy crap. Okay, and they are offering her a choice of going from that PPO to an HMO, and Kaiser is one and United Health is the other. United Health is Secure Horizons, which is available in the western part of the county, but not in this part.
But I live in Camarillo. Is that considered western?
That's western. Then you could have your choice of the two.
Okay, then my other question is, if I go to that HMO, I must use Part D. I cannot keep the company.
No, you can have. Ooh. I don't even know what the. Yeah, I think I can. If she goes with the HMO, which does have a Part D with it, can you keep your company Part D? Oh my!
It's a great. It's Express Scripts, and it's been very good.
We will make sure I have. I know I have your number, but I don't know I have your number. Make sure I have your number. We will ask that. Yeah. But if my counterpart here is telling me that she thinks you have to check with your healthcare administrator, my problem is it's another Part D which you can't have with a PPO, with an HMO. They would know. Yeah, they would tell her. We will check that one for you if you stay and write that down for me, because I'll forget otherwise. Okay.
Yes,
I'm in a little different situation, and I think I know what to do, but I'm not absolutely sure. I'm considerably older than my wife.
Okay.
And she will reach 65 in August of 2011. We're currently covered by the insurance offered by STRS, which is a PPO, okay, and those costs are $980 some odd a month.
I can't get over these prices.
And the reason that we retained that policy is because it's the family policy and the only one we could get at the time. My wife was not insurable.
Okay.
Okay, now, when her birthday comes, okay, in August, my assumption is that we can both switch to Medicare.
You always have
Part B.
you always have that right. At 65, you can't be denied going to Medicare.
Okay, so it would be at that point where we would go to Part D or Part B, and then she would be insurable then. Okay, and we would cancel out the other program. Is that correct?
Okay. At 65, if you have retirement benefits fiddling around there, you can keep them or you can drop them. You don't have to take your employer's coverage.
Right.
However, you want to make darn sure you don't want it, because if you give it up and then later decide it was a bad idea, you can't get it back.
Well, I know I don't want this. $980 a month.
Well, then I guess we don't have a problem. But I have to warn people that once you give up an employer's policy, I suppose there are some places where you can get it back, but it's very slim.
Yeah, I might lose one night's sleep.
Okay. But then, yes, you can go on Medicare.
Yeah.
Now, when she goes on Medicare,
right,
she can buy a secondary insurance, a Medigap policy, the first 6 months that she's enrolled in Medicare Part B, with no questions asked about her health.
Okay.
They can't underwrite her. They can't refuse her.
So she should simply sign up, 2 months
2 to
ahead
3
of her
months.
birthday?
You can do it. The law is you can do it up to 3 months before. I say 2 months to get all the paperwork in and that kind of stuff. And then you would need a Medicare Part D.
Thank you very much.
Okay.
Betty, there's one case where you can keep or change insurances and you can get it back. That's if you're a retired federal employee.
You federal employees have the best coverage in the world.
Thank you, Betty, but I think we earned it too.
But yes, you can.
I had a question similar to the lady over there. New to Medicare in September, next September.
Next September.
Yes.
Okay.
Is there a workshop for us, specifically for us?
There may be workshops. I don't know what I'm going to do yet next year. But if we don't have a workshop, we do one-on-one counseling. Either I do it as an advocate, or we have a group called HICAP, which stands for Health Insurance Counseling Advocacy Program. Now you know why we call it HICAP. You can have an appointment with them, one-on-one counseling for what you need. And those services are all absolutely free.
3 months before you turn 65, right?
Yeah.
Betty? Oh, okay, go ahead.
I know this probably isn't a very intelligent question, but why HMOs, PPOs, and all that, why don't people just go on basic Medicare and get a supplement? Is it because it's so much more expensive?
Not necessarily. Okay. This lady is asking, why do we give you choices? Well, because we give you choices. When Medicare first started in 1965, you only had original Medicare fee-for-service. There was nothing else. Then in 1985, they decided to come in and bring in the HMOs, and I don't know if PPOs existed then or not, but bring in the Medicare Part C stuff to give people choices, and they thought at that point that it would be less expensive for the government. They didn't say for the person. And it depends upon how well you are, but also most people during their working years who are now about turning 65 have had health insurance through their employers, and almost 95% of it has been HMOs and PPOs, so they're used to that kind of coverage. I think what you're looking at is Medicare fee-for-service with a supplemental policy and a Part D. It costs you more per month probably because you have the premium, but you're free to go anywhere in this country that you want to go that a doctor takes you. Yes, well, they dropped several. They've dropped several plans, but yes. But there are still good Medigap policies.
Thank you.
Yes.
Ladies and gentlemen, I have the good news for you. If you take one of these and look on page 13, you find the Deuced HICAP acronym with the contact numbers and all the rest of that, and much of what Betty has been talking about. The Senior Services Directory that Council on Aging produces is there for you. Please take it.
Why don't you announce the number so people listening can have it?
I will be very happy to announce the numbers. There's an 800 number, which is 434-022, and the 805 number is 381-3742, and there is also a website, AAA.countyofventura.org. AAA is Area Agency on Aging.
Right. Leonard, that number, the 805 one, is 381-2742.
Yes, ma'am, that's correct.
Okay.
And the 800 number that he gave you goes into the HICAP office at the Area Agency on Aging in Ventura. And they do return calls.
Betty, how does somebody reach you personally?
Oh, you just... I'm at the Global Center, and my number is area code 805-495-6250. We're better at answering phone calls now than we were. You used to get the answering set all of the time, but now 50% of the time we're there answering. But we do call back within a day.
And Jim, Carol here, I'd give you her cell phone number, but she keeps her life simple and does not carry one.
But so many people have gotten my home number. Okay, I need a mic up here.
Betty, this may be a little simple questions because I have SCAN.
Okay.
And it's so totally uncomplicated. But so there's some of the terms you're using I don't understand. And Medigap, is that the same as the donut hole?
No. Medigap is a special policy for people who have original Medicare. Medicare usually only pays 80% of what they approve. This supplemental insurance covers the other 20%. You're on SCAN, you don't need such a thing.
Right.
It would never help you in any way whatsoever.
So Medigap is the same as supplemental?
Yes.
Okay, so that means the same. And you pay extra for that if you have Medicare?
Yes, ma'am.
Right?
Yes, ma'am.
So maybe you had said, someone asked over there about Medicare and why the PPOs or why the, and I chose that because it was cheaper. I thought so much cheaper. I thought Medicare with the supplemental was like you'd have to pay a monthly payment in the hundreds every month.
Oh, a supplemental policy, and they're all over the place, and there's different plans, and you're different ages and what have you. But you're looking at maybe $150 to $175 a month.
Yeah.
Yes.
Yeah.
However, if you have Medicare fee-for-service and a supplemental policy, you won't be putting out any other money.
And what is Medicare fee-for-service? What's the difference?
Medicare fee-for-service is opposite. When you sign up for A and B, which you have, because you have to have it for scan. Okay, that's original Medicare. So what happens, we call it fee-for-service, because you go into a doctor, he does a service, he bills the government a fee. Okay, where a scan, an HMO, or one of those, you really, now don't all stand up and get excited, but if you have a PPO or an HMO, you are really not covered by Medicare. You're covered by the company that you have assigned your Medicare benefits to.
Yeah.
Okay? So with SCAN, this year you're going to have $29 a month, but then you have a copay every time you do something, usually. You have to pay maybe $10 when you see a doctor or so on.
Yeah.
If you're having a bad year and you're really sick, those copays can really add up. If you're in the hospital for a period of time and you take a couple of ambulance rides, all of a sudden you've spent thousands of dollars.
So if I look into the Medicare fee-for-service, I could find out about that.
Yeah, you can come see us with one of, well, I don't know if it's cheaper.
Oh.
But if you're happy with SCAN, it works.
And then something else you said, a couple things. Over there, you said that Medicare cannot refuse. So if anyone has any kind of they're going to go into Medicare now, 65, and they have any kind of an illness, they never can be refused?
If you turn 65 and you sign up for Medicare A and B, Medicare will pay 80%, so you can buy one of these secondary, supplemental, Medigap, whatever you want to call it, policies.
Okay.
If you buy it within that 6-month period, they cannot turn you down. If you wait 10 months to buy it, then you go through underwriting and they see if they want to insure you.
Okay, so
they want you young, they want you well, and they want you wealthy.
Wow.
Sounds like
So basically, the senior people had that then, that they couldn't be refused. We've already had it with Medicare. If we work within the
If you work within the time frames,
Yeah.
and that's where the high cap counselors and the senior advocates and the case management people at Senior Concerns, we know those rules, and we can tell you if you don't do it within this time period, then this can happen to you. And I just want to add, there's no such thing as a stupid question. We wish you would come to us before you do something so that we can tell you how to do it, rather than come in and say, golly, just look what I did, can you get me out of this mess? Because sometimes we can't get you out of that mess.
Yeah, and then what was the other one? Then I heard you say something about the states. So is Medicare different in every state?
No, Medi-Cal is different. Medicare is a federal program.
Okay, so what our coverage is everywhere in
Federal.
all the states. It's the same.
Medicare itself is, but within the different states, even within the different counties, because you heard me say that something isn't in this county, the Senior Advantage plans come and go and change.
Okay, thank you.
You're welcome. Got a question back there. Do I have a question up here while she's, okay. Oh, yes, sir.
I have a question that I assume you're taking open questions.
Certainly. I don't know if I know the answer.
I have original Medicare
Okay.
and a supplemental.
Okay.
But I recently got a letter from one of my specialists that says he's dropping out. And you mentioned 80% reimbursement.
Okay.
But there's already legislation to drop that by 25%, which hasn't been enacted yet. But some of the doctors are still waiting to find out what it's going to be.
That's true. He's questioning reimbursement to doctors and so forth. I'll be perfectly honest with you. We have a new law, but we don't have any policies written for most of it. So it's on the books, but it's not enacted. And what's going to happen between now and 2020, when this is all supposed to fall into place, we don't know. We can only go with what we know. But there are some doctors who, for various reasons, are saying, I will no longer take Medicare.
This particular specialist says that under the Medicare Act, he can opt out for 2 years.
That's correct. He can opt out and say, I'm not taking any Medicare patients. So if you wanted to go to him, you can, but you're going to pay the bill. And he can't take any other patient during that 2-year period who is a Medicare patient. But after 2 years, he can come back into the program if he wants to. That's correct.
But I'm concerned that they're further going to cut because Obamacare takes $500 million out of Medicare right off the top.
Okay, let's talk about the $500 million, okay? It's coming out of the Senior Advantage plans. We're reducing the payment to Senior Advantage, and we're taking this $5 million or billion or whatever it is. It's a lot of money. They are going to use that to fight fraud in Medicare, and fraud is huge. Now, the only thing that I can see, and I don't have a crystal ball, is that your Senior Advantage plans could possibly increase copays or could put on a premium like SCAN did this year. Doctors in original Medicare have a right, and this is still a free country, I think. You can kind of run your business the way you want. If they don't think they're being reimbursed enough, they can drop out of the system. If you looked at a doctor's office, how many doctors really want to say, I'm not going to take Medicare? Because I think 90% of their clients, their patients, are Medicare patients, so they won't have anybody left. But you didn't mention the one other thing that some doctors are doing. They're becoming boutique doctors, where they're saying, you pay me $1,800, $2,000 a year over and above all of your insurance, and I'm yours on a 24-hour call. So you're going to see differences. There are some doctors who will say, I am not taking Medicare patients anymore. There are some doctors who will say, I'm not taking any new Medicare patients anymore, but I will continue with the patients that I have.
My question then, it's still about reimbursement rates. How are we going to be notified about what the reimbursement rates will be?
I don't think we've been informed what they were before.
But you said 80%.
No. 80% is what Medicare pays.
The doctors.
No. Yeah. But we don't know what percentage of the cost. When your doctor bills Medicare,
right.
Let's say that you went into a doctor and whatever you had done to you, he says to you, he's not going to tell you this, but let's imagine he does. I'm going to bill Medicare $125. Okay?
I get statements from Medicare.
Okay, and it's on there. And then Medicare runs it through their little formula, and they come up with what they consider a fair amount. And they say, I'm going to pay you $100 of that $125. I will pay 80%, and the Medicare pays 80%. The 80% has nothing to do with the reimbursement to the doctor. What has to do with the reimbursement to the doctor is what comes out of that little formula where they say, this is how much we approve.
Betty, when you get your monthly or quarterly statements from Medicare, they put on the statement what the charge was.
Yes, they do.
On what Medicare pays, and then whatever Medicare pays, they pay 80% of that.
Right.
And that's so everybody should know what they're being charged or what the cost
And, you know, I say, have you read this? How many of you read your Medicare summary statements when you get them? You are the first people on the line to fight fraud, and you should look at those and see if what's on there is what really happened to you. But yes, there is a question about what doctors were reimbursed and what they will be.
I'm concerned about what they will be reimbursed.
Okay, I can't answer that question.
Saying that they're going to take $500 million out of the program so they can fight waste and fraud. Why haven't they been fighting waste and fraud?
I can't answer that, and for fear of, you know, hurting everybody's feelings, this is the government at work.
Harry, did you hear that?
Oh, Harry's a friend of mine.
Nothing Betty says makes me upset.
I have a question on preventive care. I had a situation back in 2003 where I had a colonoscopy.
I don't think your mic is on.
Oh, I'm sorry. Can you hear me now?
Yes.
Okay. I had a situation back in 2003 where I had a colonoscopy. Then recently, in this year, 2010, I had my urologist say he wants me to have another one because he thought there was some cancer or something. When I came down for the new colonoscopy, originally they were going to just put it through like a preventive, like getting the annual physical. And I was talking to the doctor, and he said, no, I'll put down exactly what the problem is in order for you to get paid.
That's right.
Otherwise, what happens is colonoscopy is every 10 years under Medicare.
It's every 10 years for somebody who's healthy, but somebody who is at risk, it is allowed more often.
Right, they allowed it, but all I'm saying is they were making a big deal out of it because of what they're saying is if you went in, like you have this new situation with preventive care, and let's say they have colonoscopy every 10 years. I just wanted to make sure, I'm sure other people had the same problem. I'm sure other people had the same problem. When it comes to billing on some of these things, you must be very, very careful how it's billed out. Otherwise, you're not going to get reimbursed. Then Medicare could say, no, we're not going to cover that.
Okay, but we can appeal those, too. We do appeals.
Right. But
this brings me...
I thought that was...
Okay. This brings me to another seminar that I do. It is, whose responsibility is it if it isn't yours? You know, when you turn 65, and I've had people come in and sit at the desk and say, well, I'm 65 now, who's going to take care of me? It doesn't work that way. It's your responsibility to understand your health care plan. It's your responsibility to understand everything about it. That's why when you get your statement from Medicare, you should look at that and see. And if it doesn't match what you think it should be, then you send it back and have it investigated. This was many years ago, but I had a lady come in because she had a mammogram, and she was charged for it. And you were allowed to have a mammogram at that time every other year. So I said to her, did you have one last year? She said, I've never had one before. So I called the billing department for that doctor. And the gal said, you know, this is the 5th question I've had about that today. I said, why don't you look at how you coded it? And she had coded them wrong. So she recoded them, and everybody got their mammograms paid for. So yes, coding is very important.
Thank you for letting me ask another question. But you mentioned, and I get this exactly, I've been very healthy, very lucky, but I'm going to turn 80 in March, and I can tell that, you don't know what the future is. I have never in my life been on regular medications. I don't take any.
Okay, good for you.
Did you say...
I hope you drink red wine.
I don't know. Whatever, I want to continue it. But if I understood you right, Betty, did you say that, because I have Humana for my Medicare D, and they had 2 different plans, and there was one different, because I was healthy, it was a little cheaper. If I continue with that, and then during the year I need medication, you can't. You have to go for the full year.
Right. Whatever Part D plan you have in effect on December 31st, you've got for 2011. Okay? There's no exceptions to that rule. Come on back, Francine.
Just 2 quick things. Could patients still bill Medicare if do they accept from patients if you wanted to stay with a doctor who doesn't accept it any longer?
We have not been able to get a decent answer out of that. I understand there is a form that our boss in Ventura says is available. We haven't seen it. I would say at this point in time, no.
No, okay.
But that doesn't mean it doesn't exist. It's something we just have not. Have you ever gotten an answer on that? But it is something that maybe we should ask.
One quick other question. The Advantage Plan PPO, is that a good deal different from original Medicare and a supplement?
We have original Medicare where you can go to any doctor anywhere that takes Medicare and you don't need a referral to go there. You have complete freedom. On the other end, you have an HMO, which you must use their doctors, you must use their facilities, and if they have their own hospital, you must use that. Halfway in the middle is a PPO, and you can go either in-network, which uses the doctors that they have in-network, or you can go outside of network, but if you go outside of network, your share of cost or your deductible or whatever it is, a copay, is more expensive. I think that doesn't do it.
I just want to know, can HMOs or PPOs turn you down?
A Medicare HMO or a Medicare PPO cannot turn you down because they are part of the Medicare system.
And they'll charge you just as much as a flat.
You will have your
change the
copay,
rates.
yeah. It's okay. I think
just
that's
a
not
quick
it.
one. Betty, you gave sort of an open door. Come hither anytime you come up want to see me, but your time must be more valuable. So you actually look for reservations, if you wish, when you're at the office or at the Stop and Shop.
At the Stop and let's talk about the Stop and Shop first. The Stop and Shop would prefer that you have an appointment, and what's going to happen if you turn in those sheets with the drugs on them, I'm going to send them to Ventura or you're going to send them to Ventura. They're going to call you back when it's done, and they're going to make an appointment for you at the Stop and Shop. For those who just don't get around to it and it's now the middle of December and oh golly, I didn't do it, they will let you walk in, but they prefer appointments. For me, at the Global Center, we do take walk-ins. We are at the Global Center between 10 and 3 Monday through Thursday, and we're there Monday 1 through 4 on Friday. You can walk in during those hours, but I also take appointments, so you may walk in and have to wait. I do prefer appointments if I can make them.
Is there a phone number for your Stop and Shop?
For the Stop and Shop, it's on the form. It's on the front of the form. Okay, Jim, I think that's it.
I'd like everybody to give a huge hand to the inimitable Betty Berry.
I have 2 questions that were written out. Can I come back?
Absolutely.
I require a specific medication that retails at $3,000 a month. Oh my God. What is my out-of-pocket expense in the donut hole? In 2011, it will be 1/2 of that. It will be $1,500.
Yikes.
If the drug hasn't gone up in price. Now that the Republicans have won the House and some Senate seats, doctors are concerned about Medicare reimbursements, which can affect not honor Medicare patients. This is possible. It was even possible if the Republicans hadn't gotten the House and whatever. It is something that's been going on for years, and they temporarily move it up and increase the amount, and then it runs out at the end of the temporary period, and we go for a few months where doctors don't know. This is a question that I can't really answer. We don't know what they're going to pay them. Okay, now I'm finished.
Okay. Once again, Betty Berry, please. We're going to take a 5-minute break and then come back and do the rest of the Council on Aging business. You're most welcome to attend. If you are leaving, please make sure you pick up a copy of our new Senior Services Directory. It's the hottest thing on wheels. So thank you again for coming.
And the Global Center.
Oh, and don't forget to
newsletter.
leave your survey sheets on the second part of Betty's agenda. Please fill that out and leave that here with us. Thank you. Report is on fraud. Martin?
I hope someone's still listening. Everybody here is gone. This is a new one for me, and new one, one that I've never presented here before. And it affects everyone, not just seniors. It'll affect any age group. It happens when you present your credit card to the cashier at the checkout counter, and he scans it and runs it through, and he hands you a receipt for your purchases. Do you look at that receipt? I don't, actually. But maybe you should, because you might, if you look at it, find an item on there called cash back, which you didn't ask for. When you call it to the cashier's attention, he said, oops, I made a mistake. Here's your cash back. Let's say it was $20, and he hands you $20. If you don't say anything, you just walked away, well, he gets to keep that $20. Wonderful source of income for him. If you do notice it and say, hey, I didn't ask for a cash back, I don't want a cash back, you'll get a big argument. It's how once it's done, I can't change it. He probably can change it. What he has to do is reverse the entire transaction, cancel it out, and start all over again. Now, I once, a long time ago, mentioned the advantages of using a credit card instead of a debit card. When you hand a credit card to the cashier, he doesn't ask any questions. He just swipes it and runs the transaction through. When you hand a debit card to him, he will ask you sometimes for a PIN number. And once he has that PIN number is entered into there, he can process a cashback. I asked a couple of two credit cards that I carry all the time. I called them up and asked them about cashbacks. One of them said, you cannot get a cashback on my credit card. The other one said, yes, but we call that a cash advance, and we require a PIN number before you can ask for a cash advance. And once you get one, there's a fee, a pretty hefty fee associated with a cash advance. In fact, if you ask for a very small cash advance, the fee may be higher than the cash advance. And of course, interest charges that apply to it. So you want to avoid this cash advance scam if you possibly can.
Is that fairly prevalent? Does it happen in any particular type of stores other than, is it liquor stores versus pet shops, or is there any statistics on that?
I don't have any, no.
Okay. Curious.
Jim, excuse me, but I'd like to interject that this type of scam is most prevalent at gas stations. And there are statistics that show that it's carried out mostly because there's younger people usually working at gas stations, and they're the ones who are onto this type of crime.
Well, usually in a gas station debit card situation, credit card, don't you get the receipt at the pump?
Yeah, I do.
But can they alter that? Is that alterable?
a lot of places you have to go inside and they swipe your card and they give you.
Yeah.
Yeah.
There's sometimes when you go to the gas station, you pay at the pump. Sometimes it won't work, and you'll get a little notice saying "Go see cashier."
Yeah.
Then you're in trouble.
Well, as a generality, I know you heard you mention the term PIN number a number of times. I guess it's pretty good advice not to give that to anybody, maybe your mother, maybe your wife, but that's probably about it.
Maybe.
Let's move on to agenda item 5B, safety, winter season precautions and tip. Leonard?
Thanks very much. Of course, I imagine the temperature is in the high 90s. At least that's what was forecast. And we didn't have a chance at a TV program last month when it was raining. And some of what I've got to say makes better sense for then than now, but nevertheless. I hope everyone understands that this weekend we do our fallback spring up agility drill, which means that we change our clocks, and we also ought to change our smoke detector batteries. Now, the next question is, well, I've got this perfectly good smoke detector battery. It's never gone off, and I really haven't tested it much, although I should have. I urge you to recycle the battery, and you can do like I do, and this is what I do.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2.
It's a little device that keeps a beat, and I use it to harass my organ students. Another problem that we've got, everybody's got these big fancy windows now to keep the noise out that's increasing on us, and one thing it does is it keeps our houses from breathing. The problem with that is that we then become likely for things like carbon monoxide poisoning. May I suggest to everyone that you think seriously about at least one carbon monoxide detector that could go in your bedroom. You got to change the batteries, or you can have it wired in. They're cheap. And I need to remind everyone, please be careful how you heat your home. You can't heat your home with your barbecue grill. You shouldn't heat it with your stovetop if it's a gas stovetop. This is a good time for saving a little energy money by baking things. That works fine. Your properly installed device in your kitchen, the oven should work fine for you. If you're using your chimney, which is to say if you're using your fireplace, you need to have it checked and cleaned every once in a while. And here again, this is where carbon monoxide detector is important and useful, particularly if you're using only the gas-fired part of your fireplace. We fear falls because we walk most times on dry surfaces. We don't understand that sometimes the shoes that we wear are very, very, very slippery if the soles get wet. This is a time to think about that. Watch it on tile, and I've shifted back over to rubber footed soles for most of my use because I know that some of my leather is very slippery. Get inoculations, please. Flu, 4 different kinds. It's really, really, really important. We can't afford to get flu. We really, at our ages, cannot afford to get pneumonia, and we can help our grandkids out a whole lot if we get a whooping cough, or as we used to call it, a whooping cough shot, pertussis. No one wants to get whooping cough at our age, but we really don't want to give it to our grandchildren or our great-grandchildren, particularly if they're very young. And finally, when I was going to talk about this last month, it was raining like Seattle out there. We think California is awfully hard on windshield wiper rubber because the sun causes the rubber to deteriorate. Even though we're not using them a whole lot, they will deteriorate. They probably ought to be changed more frequently than once a year, but surely at least once a year. Check your tires for their proper inflation. If they're improperly inflated, then they're going to be tougher to stop on. Allow more travel time. And I don't care what anybody tells you, your tires will still hydroplane, and the rule of thumb of 55 miles per hour is a hydroplaning speed is not a bad rule of thumb to follow. Not many of us have racing tires that will wash the water away, particularly on a sometimes flooded freeway. Fill your washer reservoir. Plain water works. You can add a little alcohol and soap to it if you want to, but plain water is fine. In California, our freeways are designed so that they have a high spot in the middle of the side that we're traveling on. So on a 3-lane freeway, the number 2 lane is the high lane and the lane from which water drains. Don't enter under any circumstances, not ever, any pool of standing water, and never cross running water. You'd be surprised. Well, if you're reading the news, you know that time and time and time again, people enter a pool of water that's running and have to be rescued, or they lose their lives. Standing water's got a bad habit of causing cars to overturn, amongst other things, if you hit it at speed. And finally, watch out for pedestrians in periods of reduced visibility. These are really basic questions, and I'll bet you, like me, those of you out there in television land and in the audience learned most of these rules when you were getting your driver's license and probably paid pretty careful attention to them. This is not the time to forget those kinds of things that got us thus far. Thanks, Jim.
Thank you, Leonard. Now our liaison reports. David?
Thank you, Jim, and thank you, Leonard, to remind us on all those things. First up is the VC AAA, also known as Ventura County Area Agency on Aging. Nick, your report, please.
Well, the Ventura County Area Agency on Aging is holding an open house this Friday. But this open house is only available to county employees. That's what it's designed for. They say although they don't have a specific date yet, they plan to have an open house that's open to the general public sometime later.
Okay, there we are. All right, thank you, Nick. So keep us posted so we can go up, because it is an important agency to not only the Council on Aging, but to all of Ventura County. Retired Senior Volunteer Program, Martin?
Thanks, Dave. This month, R3P is holding their boutique holiday sale. It runs from November the 8th through the 19th. It's from 9 o'clock in the morning till 3 p.m. And there you'll find a multitude of gifts, holiday items, beautiful handmade specialty articles, and of course, our delightful 50-cent greeting cards. The proceeds from the sale are used to fund Lifeline services for seniors in need. These are the services that provide a senior with an alert button that if they're in emergency need, pressing that button will bring them emergency aid immediately. So please attend the sale. Thank you.
Thank you, Martin. That is a very beneficial boutique sale for the operation of RSVP, so do get behind them and support them. They are a good bunch of folks there. Also from that same area, and our lead person over in the Global Senior Center, Andrea, is going to give you an update on what's going on over in Global Center. Thank you, Andrea.
Good afternoon. And yes, it is a warm one. It was 96 out there when I drove in. Yeah. Okay, a few things. A lot of people got our newsletter, and a couple of our programs are already full. And of course, they were the ones that are being given by Betty Berry, in which one of them, actually, I take that back. Will you pass your next driving test? Was full. Betty opened it up and is taking more. So if you're out there and you've got it coming up, a driving test in the next few months, this is the one to hit, because she will give you samples of actual tests. She'll go over the new laws and all that kind of good stuff. So, and then we also have the AARP mature safety driving class as well. So you can get your test, get a class, and be good to go. her other part, which is the Medicare changes that she was talking about, that is full. However, we are taking a waiting list. If the waiting list gets big enough, she will try to put in another seminar for those that are just on the waiting list. So you can still call in, but just realize you'll be on the list. And to follow up, yes, RSVP is having their holiday boutique, and it's going to be from November 8th through the 19th, and it's from 9 a.m. to 3 p.m. It's the hours that they're going to operate the boutique for all the good holiday stuff. They were actually undoing it yesterday, so there's some good stuff in there. So come on over to the Goebel Center and do some holiday shopping. It also saves you money. Wednesday, November 10th, and then on Thursday, November 18th, we will be having Planning for the Future. And this is through Deborah Ringer, and she's an RN with Livingston Memorial. And what she's going to be talking about is everything that happens to people. Catastrophic illness, car accident, the weirdest things, and nobody wants to think about their health care directive or their will or the things that need to be done, and then all of a sudden you're left trying to put all this into action, or your family's left having to make these decisions. I'm one of those. I am now halfway through both. Okay, so those are things everybody's got to look at. So we are having those, and she's going to be having all sorts of good information. The Wednesday, November 10th is 3:30 to 5. So those of you not working can come to that. And the November 18th one is 6:30 to 8 p.m., and that's a Thursday. So those who do work, people like myself, other boomers, people in their 40s, looking at helping take care of grandma, grandpa, aunt, and uncle, good program. Braille Institute is having their option seminar, and that's going to be Friday, November 19th from 10 to noon. And they're actually going to be having the telephone access program there, and the telephone company will provide you free of charge a telephone if you're severely hearing impaired, visually impaired, and or if you are physically impaired enough that it makes it very difficult for you to get to a regular phone that's hooked up on your wall in your house. They do not cover cell phones. These are all landline types of phones. The only thing is, though, is you need to have one little piece of information, which is a form. Doctor or registered nurse marks off the box, signs it. You bring that, you will actually see a telephone access person and be right in the system and can ask all your questions. So this is a really good way for you to come in, and we've actually got the forms at the Goebel Senior Adult Center. So we can scan them and email them to you. You can come by and pick one up. So make sure you definitely come to that. Arthritis Foundation, for quite a while, they were doing classes here in west end of the county, here, or east end of the county, excuse me. And then they were gone for quite a while. We've started them back up at the Goebel Senior Adult Center, and they are on Tuesdays from 4 to 5 and Fridays from 12:30 to 1:30. And I know the times don't match, but it can do one of two things for you. It can either fit your schedule, and you can at least make it to one, or it varies your day throughout the week. Those were the times that were available for the class, but it is really good, and there's still room in it, and it's low cost directly to them. They're trying to do $40 a month for the class. If that doesn't work for you to do the 2 days, you can definitely speak with the instructor on site and work out something with her. But they will do the chair exercises, but they're also using hand weights, and then for those who can stand and do anything else, there's a whole curriculum, so it's not your typical chair exercises of what people thought of in the past. So it's a really new, different type of way. And besides for arthritis, it's good for anybody with back problems, Parkinson's, any of those types of things. So you don't have to have just arthritis. It's just given through the foundation. In December, we'll be having our holiday party, December 6th from 1 to 3. It is free. However, tickets are only going to start being available November 10th. For in-district patrons, which means Ventura County part of Westlake, Thousand Oaks, and Newberry Park, because it fills up quickly, and we want to make sure, since we're Canal Recreation Park District, that in-district people have first shot. And then November 30th and on, whatever's left, anybody, it's up for grabs. Out of district, doesn't matter where you live. You can come by and get a ticket. And this year we are doing, I know it's ahead of time, but Friday, December 31st, which is New Year's, instead of doing our evening one, we'd kind of been dwindling, tweaking, doing all sorts of fun things. So this year we decided to do a New Year's Eve dance and lunch. So a lot of people get New Year's off anyway, so you can still come dance, you can still have lunch, you can still have your champagne toast and pictures, and you can celebrate a little early and you can stay home. So we're having fun with that one. Tickets for that are $15, and they'll be going on sale here real shortly. And you can actually sign up through the website, www.crpd.org, and do it that way. If you have problems with that, just come on in the center and we'll get it going and get you on there. So that's what's coming up. And new trips, Rose Float Parade viewing. That's a hard one. And winter break tour at Buffalo Bills and IMAX double feature with lunch at Lowry's. Those are the new trips going on sale next Friday, November 12th.
Is a copy of the newsletter available on your website?
Yes, it is.
You know, we mentioned the senior adult, the senior services directory. Might these be available at the Global Center?
Yes, they are. They're available at the Global Center. But as everybody's been saying, even though they're the newest, greatest, best thing out there, there is limited quantities. So if it's something that sounds just awesome and you're going to pick it up and toss it away in a drawer and not look at it, I would suggest asking somebody to photocopy the page you might want versus just taking the whole thing home and then not having it, because those go like hotcakes. They really do. I prefer to actually, just so everybody knows, I do give them out religiously, but I try to make sure that the person really receiving it. It's got a lot of different issues and things that they're working on, because I've had people come in for 2, 3, and 4 of them over the years when they've been done. So got to make sure when you take it, you guard it with your life.
Well said. Well, thank you. Thank you, David. This brings us down to commissioners' comments, special events announcements. Anyone have a... Leonard?
My singing partner is ill. Wilbur, you got to get well, because I don't want to hold the bass part all by myself in front of 100 and so odd people next Sunday. So no fair, no more coughing, not allowed. I'll expect to see you at rehearsal tomorrow night.
You sing bass? Sometimes.
Anyone else?
Yeah.
David?
A long-term resident and a well-known person in the athletic world, Sparky Anderson, has taken a turn for the worst. So just wanted to wish George Sparky Anderson the best. He's been a wonderful representative in the sport of baseball as well as for Thousand Oaks, and our best thoughts to you, Sparky.
Any other comments or special events announcements? Then I declare this meeting adjourned.